So this is presented by Progressive Physiotherapy and Cardiac Fitness Clinic in Chincuna Road in Cunupia. You can call or WhatsApp us at 747-5297. So what is bone marrow? So bone marrow, it is a spongy fatty tissue that is within the bones. And bone marrow, it produces red blood cells, white blood cells, and platelets. Now, red blood cells are responsible for oxygen transport. Our white blood cells is responsible for our immunity. This is what is used to fight off infections. And the platelets is used for blood clotting. Okay. So now, bone marrow also contains blood stem cells. And stem cells can turn into different types of cells. Stem cells, they are what are called undifferentiated cells. So these cells don't actually have a defined function at that point. It's only when stem cells turn into the differentiated cells, then they actually have a particular function. And so to recap, stem cells, they turn into red blood cells, white blood cells, or platelets. Now, where can you get stem cells? Okay, so stem cells, you can get them from your own body, or if there's something wrong with your stem cells, then you can get stem cells from a donor. And in acquiring stem cells, there is a process called a bone marrow harvest. And this is where the stem cells, they are collected from the hip bones, either from you or from the donor. And this bone marrow harvest is done in a surgical setting. So it's done in a surgical theater. So what exactly is a bone marrow transplant? So in a bone marrow transplant, there is a replacement of bone marrow that has been destroyed, and there's also replacement of damaged stem cells with healthy stem cells. Of course, these healthy stem cells would come from a donor if your stem cells are actually damaged. So what can cause bone marrow destruction in the first place? Well, bone marrow can be destroyed by infection, disease, or chemotherapy, or even radiotherapy if you're undergoing some sort of cancer treatment. And in the principle of the bone marrow transplant, what happens is the blood stem cells, they travel to your bone marrow, and then new blood cells are produced from these stem cells that are given to you. And there is also growth of new bone marrow in this process. So why do a bone marrow transplant? Now, you can do a bone marrow transplant if your bone marrow is not functioning properly. If you have diseases such as leukemia or lymphoma, or if you're undergoing cancer treatment. Now, a word about cancer treatment. Remember that cancer treatments, whether it's chemotherapy or radiotherapy, yes, they do destroy the cancer cells, but they can also destroy the healthy cells. So if you're undergoing cancer treatments where that has been intense enough to damage your bone marrow or stem cells, in this instance, you may need to undergo a bone marrow transplant. So what conditions can bone marrow transplant be used to treat? Well, some of the conditions that a bone marrow transplant can treat, or is used to treat, aplastic anemia, leukemia, lymphoma, multiple myeloma, also sickle cell anemia, thalassemia, and congenital neutropenia. Now, since everybody's familiar with the terms, just about everyone is familiar with the terms sickle cell anemia and thalassemia. In sickle cell anemia, the body produces blood cells, but they are abnormally shaped blood cells that do not transport oxygen very well. And in thalassemia, your body is producing an abnormal type of hemoglobin, which also does not transport oxygen very well. So what are the side effects of a bone marrow transplant? Now, with every medical procedure, with every surgical procedure, or with every drug that you take, there is the potential of side effects, and bone marrow transplant would be no exception to that. So, certain symptoms that you can experience after a transplant, a bone marrow transplant, are headaches, a fall in blood pressure, pain, nausea or an upset feeling, possible short breath, fever, or chills. Now, of course, the symptoms will be different for everyone. And the symptoms that you experience, or the intensity of the symptoms that you experience, will depend on your overall health, your age, your particular disease that you're being treated for, the type of transplant that you receive. So if you received transplant from your own stem cells or transplant from a donor, this will also affect the type of symptoms that you experience. Okay, so what about complications of a bone marrow transplant? Well, in bone marrow transplant, there is the possible complication of graft versus host disease. So if you receive donor cells, what can happen is that the donor cells can actually sense your body as being foreign, and then the donor cells can begin to attack your body. So this is why it is called graft versus host disease, and this occurs if you receive bone marrow or stem cells, sorry, if you receive stem cells from a donor. Also, there is the possibility of graft failure, where the body fails to produce the required types of cells despite receiving stem cells. There's also the possibility of complications such as cataracts, and cataracts, of course, being a clouding of the lens of the eye. Other complications are vital organ damage, early menopause, and anemia, which is also known as low red blood cell count. Of course, you will need to discuss with your doctor the risks versus the benefits if you are considering bone marrow transplant. Okay, so the presentation is not over, but for those of you from Trinidad and Tobago seeking bone marrow transplant in India, you can contact us at 747-5297. You can call or WhatsApp us. You can also submit your medical documents to us to get a free second opinion. Okay, so continuing on. So what are the types of bone marrow transplants? And generally there are two types of bone marrow transplant, autologous and allogenic. And I'm going to discuss this a bit. So in an autologous transplant, this is where your own stem cells are given back to you. So you use your own stem cells in an autologous transplant. And your stem cells are harvested before you undergo, for example, a heavy bout of chemotherapy or radiotherapy. And of course, this can only be done if you have healthy bone marrow in the first place. Okay, you cannot harvest your stem cells if you have unhealthy bone marrow, because then you'll just be getting back unhealthy stem cells. In an allogenic transplant, this is used if your bone marrow is damaged, hence you're not producing the right type of stem cells. Also, in the allogenic transplant, donor cells are used, and the donor, of course, must be a close genetic match. And it is best if you have a compatible relative if you are to undergo an allogenic transplant. If you do not have a compatible relative, then there's a registry available at the hospital in India where they can find the closest match for you. Also, with the allogenic transplant, there is a higher risk of complications, for example, the graft versus host disease. And there's also the possibility that your body can actually attack the transplanted cells. In a case like this, medications will be given to you to suppress your own immune system so that you do not attack the donated cells. However, this does put you at risk for illness because now you have a compromised immune system. But also, you will be housed in a particular section of the hospital where you'll be less likely to pick up an infection. And the success of an allogenic transplant depends on how closely the donor cells match your cells. Of course, tests will be done to determine how closely the donor cells matches yours to minimize the chances of any adverse complications. Now, a bone marrow transplant can take up to a week to perform. It is not just a matter of you receiving one injection or one transfusion. You actually need several sessions to really complete a course of bone marrow transplant. So if it takes up to a week, so which means that you should make certain arrangements. And these arrangements would include accommodation close to the hospital for loved ones, organizing your insurance coverage. So if you had a medical insurance policy, you would definitely want to start talking to your agent to make sure that you are covered and to ensure payments are made. Making arrangement for kids and pets, as well as organizing sick leave from your workplace. We here at Progressive Physiotherapy, we can help you with the travel, meals and accommodation. And we also have a representative who will be able to speak directly with your medical insurance provider. Okay, now this is how our blood transfusion is not done. This is how a stem cell transfusion is not done. It is not done through the regular IV like you see here. How it is done, actually a catheter must be inserted into the superior vena cava, which leads directly into the heart. So this central venous catheter is inserted into the superior vena cava of the heart, and then a port is placed in the right portion of the chest. So you have an external port here after the catheter is inserted, and then stem cells are injected directly into this port on the chest, and the stem cells will flow directly to the heart, and then from the heart it is distributed out to the rest of the body. Okay, so once again, multiple sessions would be needed for you to complete a course of bone marrow transplant. And this port that is inserted in the chest here, yes, it is used for the transfusion of stem cells, but it can also be used to give you fluids, nutrients, as well as medications that you might need during the process. And the recovery time from a bone marrow transplant is approximately 3 months. So this will be generally the length of time you would stay at the hospital. Okay, so again, those from Trinidad and Tobago who are seeking bone marrow transplant can contact us at 747-5297. We are in Chincuna Road in Cunupia. You can WhatsApp us or email us your medical documents for a free second opinion. Okay, so thank you for your time.